Bismillahirrahmanirrahim. The topic of our discussion today is chronic liver disease. So, chronic liver disease is characterized by the continuous deterioration of liver functions for more than 26 weeks or 6 months, and it occurs due to prevalent injury. So, deterioration in the liver functions mean inability of the liver to perform its functions, resulting in jaundice, coagulopathy, encephalopathy, and failure to perform other concerned functions. Chronic liver disease is also known as decompensated liver disease, and the duration for chronic liver disease is more than 26 weeks or 6 months. So the most common cause of chronic liver disease is hepatitis B virus and hepatitis C virus infections. Moreover, autoimmune hepatitis also results in chronic liver failure, and a growing cause of chronic liver failure include alcoholic fatty liver disease and non-alcoholic fatty liver disease. So coming on towards the pathology, in chronic liver failure, the stimulus for injury is prevalent for more than 6 months, which results in the repeated injury to the hepatocytes, resulting in loss of liver functions. So ultimately, due to repeated injury, chronic inflammatory mediators such as macrophages and Kupffer cells are activated, which result in additional injury to hepatocytes, resulting in loss of liver functions. So the loss of liver functions precipitate as coagulopathy, which is a bleeding disorder, portal hypertension, and encephalopathy. Chronic liver disease may or may not progress into liver cirrhosis. So coming on towards the clinical features, there may or there may not be a history of acute liver failure, and the disease is often presented in early stages by non-specific symptoms such as anorexia, weight loss, and weakness. There might also be pain in right hypochondrium. Moreover, there is jaundice, which is characterized by the bilirubin level more than 2 to 3 mg per deciliter, coagulopathy, and encephalopathy. Chronic liver disease often progresses into liver cirrhosis, which is characterized by loss of normal liver architecture. Liver cirrhosis results in decompensated liver disease, which is characterized by the presence of portal hypertension, hepatopulmonary syndrome, and porto-pulmonary hypertension. So portal hypertension means increased blood pressure in the portal veins occurring due to blockage to the blood flow within sinusoids. So portal hypertension ultimately results in ascites, which is accumulation of fluid inside the peritoneum, and excessive pressure also opens portosystemic shunts. The congestion in portal vein often results in congestive splenomegaly. We will discuss portal hypertension in detail in separate section. Hepatopulmonary syndrome is seen in almost 30% of the patients with cirrhosis, and it is a poor prognostic sign. So hepatopulmonary syndrome occurs as a result of excessive intrapulmonary vascular dilation. Since there is activation of hyperdynamic circulation, the blood flows swiftly in the pulmonary capillaries. This increased blood flow gives very small duration for the exchange of carbon dioxide and receiving oxygen from alveoli. So there is decreased oxygen perfusion resulting in hypoxia. So the patient complains of dyspnea in upright position. The pathophysiology of portopulmonary hypertension is poorly understood, but it is believed that it is due to the constriction of pulmonary arteries. This constriction of pulmonary arteries is occurring secondary to chronic liver disease or cirrhosis. Portopulmonary hypertension also presents with dyspnea, and clubbing of fingernails is also seen in portopulmonary hypertension. If you have any question, do let us know in the comment section. Thank you.